Okay, so we're going to be talking about anxiety and worry, and in particular, the sort of things that maintain the urge to worry and the sort of things we can do to control or reduce the frequency of worry. And the information that we're going to talk about today comes from my book, No Worries, A Guide to Managing Anxiety and Worry Using CBT. So just a little bit of differentiation between what is anxiety and what is worrying. So anxiety is the way our brain responds to perception of threat. So when we perceive that something bad can happen, we automatically become anxious. And this happens on a limbic system level. So there's parts of the brain that light up, very primitive parts of the brain, which are there to protect us. And you're probably familiar with the amygdala, the hippocampus, hypothalamus. All of these are working in tandem to try and warn us that something bad can happen. And at the same time, there's a physical response. So when our brain is telling us that something bad can happen, we have a response in the body. And the most immediate thing is increase in muscle tension, but also we may experience rapid shallow breathing, just generally more physical arousal, increased blood pressure, increased heart rate. All of that is absolutely normal and part of the anxiety response. On the other hand, worry is more a thought process. So it's happening, and if we look at the parts of the brain that are engaged in worry, it's more prefrontal cortex. So there are the thinking parts of the brain that are worried. And also we still do have some limbic system activation, and you can see the amygdala there, which is like this smoke detector, constantly monitoring threat and checking for things going wrong, and that's sort of feeding the anxiety, but also we're getting more activation in the prefrontal cortex. And there is a relationship, of course, between anxiety and worry, even though they're not the same thing. So worry is often an attempt to reduce anxiety. We're trying to reduce perception of threat by imagining all the bad things that can happen and trying to prevent or prepare for what might happen. And when we worry excessively, we often perpetuate and maintain anxiety. But also anxiety tends to perpetuate worry. So when you're in an anxious state, you tend to worry more. So the two tend to relate to each other. Everybody worries at times. Worrying is a normal process and it actually has a purpose. And the aim of worrying is to find resolution to an existing or likely problem. So if, for example, your child is running a fever or is experiencing some bullying or some distress at school, it's absolutely normal to worry because you're starting to think about, well, what can I do about it? What are the sort of things? How can I intervene? So worrying is normal when something happens or something triggers us and it is a real existing or likely problem. Excessive worrying, on the other hand, is speculative. So you're thinking about bad things that could happen rather than what has happened. And you start planning possible solutions to possible problems. And it sometimes is a symptom of generalized anxiety disorder. So generalized anxiety disorder is characterized by excessive worrying and some other features as well. So the diagnostic manual, DSM-5, that defines generalized anxiety disorder, defines it as excessive, uncontrollable worrying about more than one domain for at least 6 months, causes distress and interferes with daily functioning. And in addition, there are at least 3 of the following symptoms. So with generalized anxiety disorder, there's muscle tension, there's restlessness, fatigue, irritability, sleep disturbances, or concentration difficulties. So 3 of those 6 symptoms are part of generalized anxiety disorder. So when we think about what is GAD and how does it affect us, it is one of the most common of the anxiety disorders. It affects between 4 and 7% of the population, depending on which study you look at. It affects women twice as often as men. And generally the prevalence increases with age. So as people get older, they're more likely to have had or have generalized anxiety disorder. And because it's a disorder that doesn't normally go into spontaneous remission, for most people, once they have generalized anxiety disorder, they remain in that state unless they have treatment. And many people don't realize they have GAD And they would just say, look, I've always been like this. I've always been a worrier. And what they don't realise is actually this is an anxiety disorder and it's treatable. You can certainly learn to manage a lot less, manage to worry a lot less and feel a lot better. So when we think of general anxiety, especially something like panic disorder, you often think of fight or flight. With generalized anxiety disorder, it's not so much fight or flight, it's a vigilance response. It's like your brain is constantly scanning the world for threats, so your nervous system is constantly activated. And so you may feel like it's hard to wind down, it's hard to relax, it's hard to sleep, it's even hard to concentrate because you're constantly sort of nervy. And it often co-occurs with other disorders. The most common are anxiety disorders. So with GAD, you may also have social anxiety disorder or panic disorder or phobias at some stage. You may also have, for example, obsessive compulsive disorder. It also has quite a high co-occurrence with depression and bipolar disorder. And also with somatic symptom disorder, which is that disorder where we're perpetually focusing on body sensations that feel like a threat. And then, of course, when we focus on something that feels like a threat, it keeps happening. Or illness anxiety disorder, which used to be called hypochondriasis in the past. And physical symptoms are absolutely very common, what we call somatic symptoms, when we have generalized anxiety disorder. And for example, the things that most people experience: tightness in the chest, breathlessness, neck pain, headaches, head pressure, dizziness, fatigue, heart palpitations, jaw pain, upset stomach, nausea, irritable bowel, belching, excessive urination, of course, as well. And lots of medically unexplained symptoms. So people will often say, I've been worried about this thing, this irritable bowel. They have lots of tests, lots of consultations. They may even go to hospital at times for a number of tests, and basically everything comes back pretty normal. Interestingly, people with GAD are often more likely to use complementary therapies or unproven therapies, so all these alternative therapies, sometimes very reluctant to use mainstream therapies like antidepressant medications, but are willing to try or take remedies that have no proven base. And they're also much more likely to visit GPs. In fact, people with GAD tend to have, on average, about twice the frequency of GP visits compared to the majority of people. The diagnosis is often missed, so people with GAD often don't realise they have GAD, and they may be getting all these symptoms. They may go to the GP, and the GP is sort of doing lots and lots of tests, or they may go to the psychologist with other conditions or other concerns, and it may be health anxiety or relationship issues or depression. And unless there are specific questions that are asked to screen for generalized anxiety disorder, very often it's missed. And the problem with GAD is it really impacts on quality of life. So people sort of say, look, I'm just constantly anxious, overthinking, overanalyzing, I'm not present. So you might be on a holiday, you might go to some lovely place, or you might be at your child's birthday, and you can't engage, you can't enjoy whatever it is that you're doing because in your mind you're always sort of going elsewhere. And also that constant nervous system activation. So there's that muscle tension, there's arousal, there's exhaustion. So that constant feeling of it's so hard to relax. And people with GAD tend to engage in catastrophic chaining. And that means you sort of start thinking one thing and then the next and the next. For example, I heard that Chloe has 25 students in her class, and this is a mum who has GAD. And she's thinking she won't get enough attention, she won't learn effectively, her education will suffer, she'll end up poorly educated, she'll miss out on a good career, and she'll be disadvantaged for life. So that's a good example of catastrophic chaining. You're sort of already 3 or 4 steps ahead of what could happen in the future. So if you're wondering, do I have GAD? Whether you have GAD, here are some things to think about. First of all, just think about, I worry a lot. I overthink things. Are you someone who's always thinking and analysing and thinking too much about things? You can use just a very simple screener. It's certainly not diagnostic, but you can Google GAD-7 questionnaire, and you can use that just as a little bit of a screening instrument. There's also a good screening instrument called the Penn State Worry Questionnaire, which specifically focuses on worrying. And again, you can find that online. Or just think about the actual diagnostic criteria in the DSM. So it's excessive worry for more than 6 months, plus, how many of these symptoms do you tend to have most of the time? And if you have 3 or more, that might suggest that it'd be useful to see a mental health practitioner and get a diagnosis. So if you find that you do have GAD, or even if you don't, even if you just worry too much, here are some things that you can do about it. And the first thing you've got to think about is build awareness of cognitive processes. So we often talk in psychology about from content to process. So rather than getting caught up in the content of your thoughts, start to think about how your mind works. Start watching your own mind and noticing how your mind keeps pulling to threat. And one of my favorite quotes from Sam Harris is about, we get lost in the content of our thoughts without even realizing that we're thinking. And that is the string upon which all our suffering is strung. In other words, we are so caught up in thinking, we just assume that it's truth. So mindful awareness is starting to notice thoughts as they arise. It's the capacity to be able to step back and say, look at what my mind is doing right now. Start building an understanding of how your mind works as it's doing it. Start to notice and identify thoughts as just objects of the mind rather than truth or reality. And start to notice your own cognitive bias. My mind is biased towards threat. It keeps pulling towards threat. There it goes again. I just had another worry thought. And label it as a worry thought. It's just more blah, 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 blah. Worriers get caught up in the content of their thoughts. And typically, if you're a worrier, you might spend time ruminating or thinking about, look, I said the wrong thing. They probably think badly of me. My child could be disadvantaged. What if I lose my job? Why am I feeling this tingling? Could there be something else going on? So we get caught up in the content of those thoughts. But what we don't realize is that, again, it's blah, 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 blah. We get too lost in that content. So what's the real problem? It's not the things that we worry about. It's the way that our mind works. It's the way that we keep pulling towards threat, that compulsion to keep scanning for threat. So if you start changing your focus from all the things that you're worried about and being the problem, to actually recognize, no, this is a thinking problem. It's actually not a danger problem. It's a thinking problem. We then need to focus on changing our thoughts. So what perpetuates the urge to worry? Why do we feel drawn to worry? Well, underneath that urge is the belief that worrying is protective and that it'll help us. And the technical term for that is metacognitive beliefs. So metacognitive beliefs are beliefs about our own thought processes. So when we talk about cognitive, we're talking about cognitions. So metacognitive beliefs are beliefs about our own cognitions. And the most universal belief that perpetuates generalized anxiety disorder is the assumption that worrying protects you in some way. And to stop worrying makes you feel vulnerable or exposed. And here are some specific metacognitive beliefs that you may have about the process of worrying. Worrying gives me control because I can anticipate and prepare for negative events. Worrying helps me to solve problems. Worrying prepares me for the worst, and so it reduces distress if a negative event occurs. Worrying can prevent bad things from happening. And worrying is a positive personality trait. It means that I'm a prudent, caring, or a good person. So these are just examples of assumptions that we often make about the protections of worry. And, for example, if I didn't worry, then maybe I might lose control of my workload and it'll overwhelm me. Or if I didn't worry, my daughter might come to harm and I would be a bad mother. Or I might miss a serious health issue and then it'll be too late. Or I won't be prepared for negative events that could arise. So the assumption is if I didn't worry, something bad could happen. And just to identify whether that might be a factor in your thinking, I want you to just pause for 1 minute, and literally 1 minute. I'm going to get you to close your eyes. Close your eyes now and visualize yourself at home on an armchair or just on a couch, relaxing. And notice that something is very different. The urge to worry has disappeared. You are no longer worrying. You are incredibly calm, and there is no urge to worry. You've completely forgotten about worry. And as you visualize that, on the one hand, you think, yeah, that would be great. But on the other hand, you might notice that there's some resistance, that there's part of you that is kind of not wanting to relax too much because it kind of feels unsafe to be completely relaxed. And if you notice any of that resistance, usually that's because of your metacognitive beliefs. So there are some beliefs that are saying, don't relax too much, I might miss something. So one of the really useful and important things to do when we're sort of trying to get to the underlying processes that maintain the urge to worry is to challenge those metacognitive beliefs, the assumptions that worrying is protective and helpful. And first of all, we're going to have a look at some very simple things to remind yourself when you're challenging metacognitive beliefs. For example, the belief that worry helps me. So what about people who don't worry? Are they in danger because they don't worry? How can they have successful lives if they don't worry? And if worrying is helpful, would it help you to worry more? Could worrying make you less safe because you miss things, because your mind is completely preoccupied with all the things that will happen, and so you're not present, and then you miss important things? Maybe worrying has the opposite effect that you believe. In all the times that you've worried, how often did your feared outcomes eventuate? In other words, you may have worried hundreds of thousands or maybe millions of times. How many times were you right in the worst thing that would happen? And in those situations, would it have helped you if you'd worried more? You know, did worrying add value to the situation? Did it actually protect you in any way? And is your premium greater than the payout? And this is, the question of, if you believe worrying protects you from distress, then maybe the cost of worrying is far greater than any protection that you might get, even if something bad does happen. So you're paying too much. It's like having an insurance policy where you're paying $1 million a year, and if you make a claim, the maximum you can get is $100. I mean, it's not good value. Your premium is too great for the payout. And also for the belief that worrying helps me to get things done. Are you confusing with worry with problem solving? Is it possible to problem solve and get things done without worrying? For example, is it possible to clean the house, keep your house clean, be effective at work, look after your health, be a good mother without worrying? And if you believe that you have to worry in order to get those things done, how do other people who don't worry get all of those things done? Does worrying really add value to completion of tasks? And if habitual worrying provided advantages, wouldn't you expect people who worry a lot to be more successful, more effective, better parents and healthier than other people? And in fact, we know that the opposite is true. Often worrying excessively really impacts in a negative way on all of those things. So there's certainly all the evidence points to worrying doesn't protect you. It is just an illusion. You think that it's helpful, but in fact, it's not. So one of the useful things to remind people to do is notice that initial worry thought when it first pops into your mind. And one way of thinking about it is it's like a hook pops into your mind, and there's a temptation to immediately swallow that hook. And once you swallow that hook, so the worry thought pops into your mind, and then it's blah, 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 blah. You engage with intrusive thought, and then what if this happens? What if this happens? What if this happens? So that's engagement with the worry. And the key thing is to learn not to swallow that hook. Or even if you swallow that hook, you can spit it out when you realize that you've engaged with that worry thought. So mindful awareness helps us with that. Notice worry thoughts when they arise and choose not to engage with them. And using worry time can help you. So let's have a look at worry time. And there's different ways of using it, but one of the very simple ways of doing it is just getting a very small pad that you carry in your pocket. Or you can, of course, use a phone if you're used to carrying a phone everywhere. But you can get yourself a worry pad and start to be vigilant to the hooks or to the worry thoughts that pop into your mind. And as soon as you notice that a worry thought has popped into your mind, log the thought either in the little pad or in your phone. Park it for now until worry time. And you need to set worry time. So you might decide worry time is at 7:30 in the evening, when you can review your worries then. But the key thing is training your brain not to engage with a worry thought just because it pops into your mind. If you want to work on that thought, you do it during worry time. For example, 7:30 or 8 or whatever time you set for yourself. Or you can use, there is an app that we call the Worry Time app, which is available at no cost. It's by Reach Out, and it actually just facilitates that. And the advantage of the app is it will send you a notification when it's time to worry. People sometimes say, do I actually need to go back and read my worry thoughts during worry time? And generally, I sort of encourage people to do that, because when you do go back to those worry thoughts, they often seem really trivial and unimportant. And the important worry thoughts that you really do need to look at, you can then look at during worry time and say, okay, can I problem solve that? And if I can't problem solve it, if it's something I have no control over, I'm just going to practice mindful allowing. I'm going to learn to relax into that thought because I can't change it. So what is learnt? First of all, it helps you to notice the emergence of worry thoughts when they enter your mind. And that's really important. You start to notice the hook. Start to notice the hook, and you don't have to swallow it. And it helps you to resist engaging with worry thoughts. So you notice the worry thought, but you can choose not to engage with it then. And by logging the thought, writing it down, either in a pad or in your phone, it means you won't forget it. You know that you'll come back to it during worry time. And that actually makes it easier to let go of that hook at the present time. And over time, when you keep using worry time, and day after day after day, you learn that you don't have to engage in worrying. It's a little bit like physiotherapy for the brain. You do it enough times and you start to realize, you know what, I didn't worry. It made absolutely no difference. It's safe not to worry. And that's a really important aha moment. What we're trying to get is that aha moment where you learn through experience that nothing happens. Whether or not you worry makes no difference to outcomes. Worrying does not protect me. It does not change things. And it's that experiential learning, because you probably know logically that worrying is not helpful, but it actually gives you experiential learning that your assumptions about the protections of worry are incorrect. And that's an important aha moment. That realization, whether or not I worry, makes no difference to what happens in my life. And that's helpful. And it's safe not to worry. I can stop worrying and nothing bad happens. And that's also a really important awareness. And finally, I just want to mention safety behaviors. So one of the things that perpetuates anxiety, so for anyone who's anxious, is just engaging in a whole lot of safety behaviors. Safety behaviors are an attempt to keep your world safe, but they prevent you from learning that you are not in danger. And safety behaviors just feed anxiety and maintain anxiety. I want you to think about, what are your safety behaviors? And perhaps it's monitoring your children too much. Maybe it's calling them or saying, are you okay? Or always saying, drive carefully. Or, I don't know, being overly perfectionistic in tasks that don't require perfectionism. So think about, what are your safety behaviors? Here are some common safety behaviors. Being excessive attempts to be in control of yourself or others. And in fact, people sometimes say, oh, I'm a bit of a control freak. If you're a control freak, you're anxious. And that excessive attempts to control are a way of trying to make yourself safe. Just avoidance of feared situations is a really common safety behaviors. Perfectionism, over-preparing, reassurance-seeking behaviours, constantly asking a partner, do you think I'm going to be okay? Do you think all is good? And reassurance-seeking might involve going to get second and third and fourth medical opinions. Phone calls are really common safety behaviours, checking in with family members and chronic dizziness, busyness. And cognitive safety behaviours. So not all safety behaviours are actions. Some of our safety behaviours are things we do with our mind, and that includes things like hypervigilance, just focusing on something excessively, worrying, overthinking, overanalyzing, and worrying is a safety behaviour. Mentally rehearsing things or reviewing conversations in our mind. Did I say the right thing? Did that sound bad? What do they think of that? Anticipating, analysing, planning solutions to imaginary problems. And even chronic dizziness can be a cognitive safety behaviour because we make ourselves excessively busy in order to block ourselves from thinking about other things or to block ourselves from focusing on threat. So that can also be a cognitive safety behaviour. And again, this is for anyone who's anxious. Create behavioural experiments. Think about the things that you do to try and make yourself safe and see what happens when you drop your safety behaviours. So you gradually learn through experience that your world is actually pretty safe. And even if some things don't work out, in the end, you cope. There are rarely catastrophic consequences. And the advantages of learning to be less anxious far outweigh some of the things that you worry might happen. If you're interested in finding out more about treatments for generalized anxiety disorder and worry, here are some of the really good ones in Australia. Centre for Clinical Interventions has a wonderful, but it's in just written format module, What Me Worry. This Way Up has some fantastic programs, and the one on generalized anxiety specifically focuses on managing worry, and it's interactive. And again, excellent program. Mental Health Online has a program called Anxiety and Worry. And also for children and adolescents, have a look at the BRAVE program because it has a number of modules on managing anxiety for young people. And if you're interested in, so this is just sort of a couple of the strategies we talk about in No Worries. If you're really interested in finding out more about how to manage anxiety and worry, I encourage you to have a look at my book, No Worries, A Guide to Managing Anxiety and Worry Using CBT. And you might also be interested in my other couple of books, Change Your Thinking or Good Thinking, which is for teenagers, which was co-written with my colleague, Louise Ramond. I hope this session has been useful and has given you some insight into what you can do to reduce worry and anxiety. Good luck and all the best for managing anxiety in the future.